you guys work harder than doctors in terms of the hours that you pull, right? And yet you're underappreciated. Yeah.
Well, you are seen as like the holy grail, the doctors generally.
Today, I'm hosting one and the only person who in our line of work forms the core of healthcare. Without this kind of a person, there is no healthcare. And there's no better person than Whitney Houston. You heard that right, Whitney Houston. She will always love us, I guess. I'm hosting Whitney Houston, who is a mother. To me, that's probably more important. A long-term partner, a registered nurse, a lecturer, and she comes from a background of medical people.
I feel like because we're there with the patient all the time, they tend to take us for granted. And they know that also we're less qualified. So they take us for granted.
You're not less qualified, you're differently qualified.
Yeah, but they see it as that.
For me, as a doctor, one of the most important things, what you're saying resonates with me completely, was what was called community health, which is also social. Because I remember I went to a place called Dalton Hostel. So these people, when they go back, so you treat them for dysentery or gastroenteritis, whatever it is, infectious diseases. And they go back to the same place where they picked it up from. And people that they live with in close proximity in these overcrowded places, it basically is a revolving door unless you understand what's happening. So in community service.
Exactly.
So that's something that's extremely important that I think you and I do agree that should be incorporated into our healthcare industry. I've been a patient, had terrible COVID. I was supposed to be ventilated. My doctor hardly ever saw me, actually never touched me. So who was there for me? My nurses. What the nurses did for me was what my doctors didn't do. They're the ones who were comforting me. They're the ones who were telling me I'm getting better. They're the ones encouraging me. Welcome to family of Rhythm Unplugged. I'm with Creative Replay today. As usual, thank family for joining us. Today, I'm hosting one and the only person who in our line of work forms the core of healthcare. Without this kind of a person, there is no healthcare. I can't think of maybe outside GP general practice where a doctor can work without a nurse. I can't think of anything, but a nurse can work without a doctor. And to me, it's fundamentally important that this line of duties is unveiled, explained to the public, and there's no better person than Whitney Houston. You heard that right, Whitney Houston. She will always love us, I guess. I'm hosting Whitney Houston, who is a mother. To me, that's probably more important. A long-term partner, a registered nurse, a lecturer, and she comes from a background of medical people. Whitney Houston, the floor is yours. Tell us about yourself. This is Whitney Houston, a professional nurse, as I explained. I'm happy to have you today on Rhythm Unplugged.
And thank you, Dr. Brian Vezi. So, I'm Whitney Houston, as you all have heard. And I've been practicing for 10 years clinically, and then decided, no, the hours and all that is just not working with kids. I've got two babas, a 7-year-old and a 3-year-old girl. And that's when I turned over a new leaf. So I started to go into education, which I had already studied, but I wasn't using it because you can't really use it without clinical experience. So I went into teaching. I'm teaching at medical school in FTC Durban campus and loving it for the last 2 to 3 years now. So new into the teaching, coming out of my shell, love being a mother. Being a nurse was tough, but we're going to speak more about that now.
I'm ambivalent about the fact that you're leaving nursing because, of course, I'm a doctor and I cannot work without you. But I'm happy for you. I forgot to mention family. So Whitney is not just a nurse, but also she did education degree. She's an educator. So this is a very, very highly qualified person that I'm with today. And I'm really, really excited. I often say I'm excited, but today I'm particularly more excited because it makes me think that 1 year ago when I qualified as a doctor, one of the most important people was a nurse. That I think that should continue to happen when, as a junior doctor, you look up to nurses because they've been there before you and teach you. You're leaving us. I don't know, but I'm happy for you. I'm not happy for my industry because we are losing one of the best people in the forefront. So let's go back to where you all started. Why nursing? And while you're pondering on that question, I'm asking you this because, let's be honest, there's no glamour in being a nurse because it's hard work. And people are generally not grateful. So you'll see a lot of people, youngsters, not wanting to do nursing. And as I said, there is no doctor outside family practice, GPs, that can work without a nurse. So you are very important. I'm glad you are a nurse. But like I said, it's a double-edged sword. We need it, but you're not being appreciated. People generally have a certain perception. Why did you choose nursing?
So initially, I'm going to be honest here. I didn't actually want to do nursing initially. When I was choosing what to study, I was more into drama and performing arts. But looking after going to open day, you realize, you're not guaranteed to be successful in those fields. So my mom actually spoke to me. She sat me down and said, you know what, she loves healthcare. She's a paramedic, was a paramedic. So she told me all the options. The first thing was being a doctor, of course. When I went to the stand of being a doctor, they told me you give up your entire life to be a doctor. And when I heard that was a no-go for me. So the next best thing that was more my personality, more engaging with people, was nursing. And that went with the whole drama and all that, and caring. So it just matched my personality. So I did an interview there because I started a bit late as well. And they loved me when I went. They were like, come, we're going to join you. It's past registration, but come. So I went, studied for 4 years. That was the best time of my life, as students.
My medical school was my best life, for sure. And I really need to write the book. It was beautiful. So I'm glad that you also enjoyed your nursing.
It was amazing. I loved it. That 4 years was amazing. Midwifery just reeled me in. When I did midwifery, so gynae, you would call it, or then gynae, I was just in. I knew this is me. That is what I'm doing. I didn't really like anything else, really.
Sorry about that. Sorry to interject. I was just talking to a nurse yesterday, and we were talking about episiotomy. So for those who know nursing and medicine, episiotomy, it's a master art, post-delivery, normal vaginal delivery. And she said to me, no, I didn't do gynae. So how's the standard of practice, or rather of training? So you can become a registered nurse without doing midwifery?
No. No, well, you can be a registered nurse, but remember the bars that we have are for different things.
Tell me about the bars.
So the bars, I have 4 bars now because of education, but you come out with 3 if you do the 4 year. Yeah, so heavy on the shoulders.
Yeah. Lots of expectations.
Yeah, so that's it's not really a nice thing when people look at you with the bars and they're like, you look like a matron, but you're not a matron. So there's also that aspect. Yes, there is.
So tell us about the bars.
So the bars, if you do a 4-year basic, you come up with community. It is midwifery and psych one. Okay. So you come out with those if you do all 4. But there are nurses that are staff nurses, and they just choose one discipline to go in. So they come out with 1 extra bar. But a registered nurse had a round silver bar. I should have actually brought it.
Yeah, it would have been nice. Yeah, because you never know how to differentiate.
Yes, So it's really nice to come out with all, because you can choose where to go. If you have all 3, you can choose any discipline.
And you are called in South Africa sister.
Yes, registered nurse.
SISTER.
Yes, sister.
The reason why I'm asking you this, so I worked overseas, and I worked overseas, and I went there, and I said, where's the sister? And someone said to me, this is a true story. You have a sister working here? I said, no, a sister, a nurse. And then this other dog said, why do you call her a sister? I said, that's what we call them. Is it a regional thing? Because definitely North America and Europe, okay, North America, I don't know about Europe, they are
don't.
not called sisters.
Yes,
It's a
yes.
very South African lingo.
Yeah, it
Do you know
is
where it
South
comes from?
African. I don't, but it's always been like that here.
Yeah.
We just know it as sister.
Okay. Quick pause, guys. Today, the whole podcast is totally sponsored by Creative Replay. You know who they are, Mawanda, Mapumo, Mashimane. So we've been together, probably going to be closing on a year. When I first started on this journey, I thought I could make it. And all my colleagues are asking me, who's doing that work for you? For two reasons. One is the quality that they bring into the podcast, and two, professionalism. So I don't have time to be doing this all by myself. I do joke about it and say I'm doing it, but Creative Replay has been behind this wonderful, relatively short journey, but very, very meaningful. So they take away all the stressor of doing something like this, because I'm really passionate about impacting knowledge and my experiences, and Creative Replay makes it easy for me to manage my time and to engage with you as a family. Thank you very much once again, Creative Replay, for doing all what you've done for me. Big up. All right, let's go back to, for me, something extremely important. Mm-hmm. I'll jump into it. Mm-hmm. Why is this perception about the nurses by public that they feel the way they do and entitled? I'm going to give you an example. For instance, patients and families are quick to complain about the nurses. Almost never satisfied, even though, okay, I'm going to walk everybody back, family. So if we have a patient who's admitted, the sister, the nurse, will probably do like an 8 or 12-hour shift, but the doctor comes and does around for like 4 or 5 minutes per patient, 10 minutes max. Yeah. And these patients stay with you basically forever. You are the one who has to administer medication. You are the one who diagnoses new things. You are the one, if something changes, you notify a doctor and start doing whatever it's needed.
Yes, yeah.
So clearly, you form a core and probably the most important part in patients management.
Definitely.
Do families and patients understand that you're the one staying with the patient? You're the one who's picking up changes. You're the one directing the doctor.
They don't unless you explain it to them. So, for example, working in government, there's no time, okay? The nurses are just going from patient to patient, doing their duty. You have patients lined up for you. So there's no time to explain. But in private, from my experience, because I'm more of a private nurse, I only did 1 year in government, we have the time to explain. And when you're nice to them, they understand anything you tell them. When you're nice. But not many people are nice. So that's where that comes in also. So if you're working in a private hospital, generally they do an interview to see if you're a nice person before they take you. Okay. But yeah, it's tough.
How would you change that perception? Because it's real. You guys work harder than doctors in terms of the hours that you pull, right? And yet you're underappreciated. I can talk as a doctor, for instance. You could call to try to reach out to me. First, you may not be able to reach out to me.
Yes, yeah.
And you reach out to me and I tell you, I'm going to be there in an hour. And generally when the doctor says I'm going to be there in an hour, he's going to come there 2-3 hours late. And family constantly thinking that you haven't contacted the doctor or contacted him again. That pressure that comes with it. What makes you to keep going? Not a lot of people. And the thing is that when the doctor comes, it's hunky-dory, everything is not, hi, doctor. Even the patient who was like, via the nurse sister, complaining bitterly, I'm going to sign an RHT, refusal of hospital treatment. As soon as the doctor comes, everything changes.
It's fine, yeah.
Yeah.
Well, you are seen as like the holy grail, the doctors, generally. So it is like that. I don't know why, but they trouble the nurses to get seen quickly. Naturally, if you're a patient, you would do the same thing.
Well, but it's in the name. For me, family, Rhythm Unplugged, the definition of the word patient means you need to be patient. All right? That's what it is. You've got to be patient. That's why you call it a patient. Right? I'm not saying we'll waste your time, but I just find this double standards when it comes to how the public perceives a doctor and how they perceive a nurse is totally different. Yet these are the people, like I said, they spend more time with a relative or with you as a patient. And the doctor is still very, very important, nurses is with you all the time administering your medication, has to get it right, for X number of patients. So I don't know, but it's one of those things that you as a nurse, maybe can break it down to us.
I feel like because we're there with the patient all the time, they tend to take us for granted, and they know that also we're less qualified. So they take us for granted.
You're not less qualified, you're differently qualified.
Yeah, but they see it as that because
But
would
they
say,
need to understand
you're
that.
just a nurse.
A doctor is not a nurse. A nurse is not a doctor.
Yeah.
You've got a common purpose. You are not less qualified. You're differently qualified.
Yeah, no, you're right. It's just the patients don't see it like that.
I wish they did.
Because they tell us to. They're like, no, we're waiting for the doctor, not you. Even if we explain something that we know, from the condition, they're like, no, I'll wait for the doctor. So the best way to deal with that, I think, is like an outreach sort of. And like social media. So like to communicate with them. But older people don't really keep in contact with like social media and watching.
But I think it's a perception that needs to change, because for me as a doctor, I know there is absolutely no way I can do my procedures. There's absolutely no way my patient would be cared for the way they're supposed to without a nurse. And I'm not trying to put you on a pedestal. You belong on that pedestal.
Yes. No, I understand that. I do understand that. It's just the patients see it completely different. How I think of it also is if you were a patient and you were very sick now, how would you feel, if the doctor hasn't come to see you and it's been 3 hours?
I've been a patient. On the eve of Christmas 2020, I had terrible COVID. I was supposed to be ventilated. My doctor and someone I know and who taught me at medical school, an HOD of department, hardly ever saw me. Actually, never touched me. Never touched me. It was like I was a leper or something. So who was there for me? My nurses. But I'm not necessarily always nice, but I think I'm a nice person. I've got personality disorders, but I think I'm a nice person. What the nurses did for me was what my doctors didn't do. They're the ones who were comforting me. They're the ones who were telling me I'm getting better. They're the ones encouraging me. And the worst thing for me is that I cannot even recognize them, because everyone was all clothed
Covered,
up with PPEs. So I've been a patient, so I can talk as a patient and I can talk as a doctor, right? They helped me a lot.
Yeah. No, I can only imagine what you went through, hey?
And those nurses were there for me.
I had COVID, so I know the feeling. Yeah, the thing is, the doctor's job is not to be there to empathize a lot of the time. So we have to work with reality. The nurses, we are there. We work shifts for a reason. So that's what, we are there to comfort the patient, to promote healing. And then obviously the clinical parts, medication, following orders. And then if there's no new orders, like with COVID, there wouldn't be much new orders. You give one order.
That's it. And you hope you live.
That's the thing. So like the doctor's not going to be there. So it's just the reality, eh?
Okay, talking about reality, let's flip the script a little bit. Do you think there are things that nurses do that make the public see them the way they see them? For instance, we know that if you are 16 and you're pregnant, not all, they will shout at you. Why are you pregnant? Why are you opening your legs? Why are you screaming? You're going to be here in 2 years' time. And maybe you do. And then you come for your third baby. They've been shouting at you. Now you want to maybe have tubal ligation to stop, and then nurses will shout at you. Don't do it. That can be confusing as well. So I'm flipping the script now where possibly certain things that nurses do that some patients and families don't take well to it.
Yeah,
why do nurses do that, if they do that?
So they do that, definitely. No lie about that. Okay. But the thing is that the influx of patients, especially in the States, so in government. And with the influx, a lot of the time you're getting young pregnancies. You can see they were not doing family planning. So nurses, especially older nurses, where there's no filter or they've had enough, they're going to blurt it out.
Yeah.
So the younger nurses don't generally do that from my experience. But with age, if I was working in government for many years and I was stuck there, I probably may say a comment,
Yeah.
Because there is family planning. It's free, And we train you from young, school. to do these things. The only thing I don't like about that judgment with the comments also is that there are women who can't help it. So there's abuse and stuff. So you don't know what they're going through when they're coming now with a teenage pregnancy or multiple pregnancies, and they don't know. So they're uneducated. So in that case, they should be sent to the social worker. You know, instead of making that comment, why are you back? When are you coming back?
The recruiter's hands, yes. And also shouting at the end of the ward, hey, so and so, she's back again.
Yeah.
Oh, so and so, oh, we've got STI again. You know,
It's rude. It is completely rude.
So we in the medical fraternity, and because we're hosting you today, Whitney Houston as an RN, educator. So it's important to get as many sides to this story, because one of the reasons why I wanted you to be on my show is, one, first, I've got affinity for nurses. Number two, I don't have a choice. I have to work with the nurses, and they do a great job. But there are those perceptions that where I feel that you are misrepresented by the community, the perception. But there are certain things that nurses do, and you've alluded to those things. One of the things that I didn't think of, and you just mentioned now, is that maybe, just maybe, we should incorporate social workers into our healthcare.
Definitely, because they are there in government, but I notice not many people go there unless it's severe now.
Yeah.
But in the private sector, there's no social worker, not that I've seen.
Yeah.
And I was in private for a while.
Yeah. You mentioned that one of the bars is when you do a 4-year degree is community.
Yes.
So what does that entail? Does it make you have a better perception of the community that you might be working with?
It does. It does. That's what's important. So we got sent to the old age home and then a poor community. So I was sent to Marion Hill for mine. Very interesting. It opened my mind from being at home, raised as like just a good girl in high school, you know. You don't see the world, especially that side. So when I was placed for community service, and the other communities are also these hectic stories, your whole mind is opened up. So when you do go practice with the people in government now, the patients, you understand where they're coming from instead of just judging them. You know? So community is very important, and old age home, you cannot do nursing without going to the old age home.
Yeah, and we're living longer now. Yeah, so for me as a doctor, one of the most important things, what you're saying resonates with me completely, was what was called community health, which is also social. Because I remember I went to a place called Dalton Hostel. So for those who are not aware about our socio-economic issues in South Africa, so a hostel will be largely African men, Black African men who are young in their prime. They have to come to big cities, either for mining or for better job opportunities, and they'll be clumped together in one room. Instead of being maybe 2, they'll be in a 4 or 8. So these people, when they go back, so you treat them for dysentery or gastroenteritis, whatever it is, infectious diseases, and they go back to the same place where they picked it up from. And people that they live with in close proximity in these overcrowded places, it basically is a revolving door unless you understand what's happening. So in community service, so that's something that's extremely important that I think you and I do agree that should be incorporated into our healthcare industry, because like you said, it's very easy for you to be judgmental. But you also raised a point whereby, particularly among Black girls, where a relationship is defined by having a baby for that particular boyfriend at that particular time. It doesn't really matter that you're coming with 3 kids from 3 different fathers. That boyfriend promises to marry you if you get a baby. But some of our sisters, not nurses, sisters as in our female human beings, they feel that you need to validate that with a baby. So I think it's very important, that point that you raised, that we don't know where they're coming from. We can only hope and educate them, because you know what? You've got 3 different kids. You've got 3 kids, 3 different fathers. What makes you think the 4th father will do what the other 3 didn't do? But it's not for me, maybe as a doctor or a nurse, to
comment,
shout and say, "Oh, you're back again, and we'll see you next year." Because those are realities of our socio-economic, and it usually hinges on the level of education.
And that goes with everything, actually. You don't know where they're coming from with any discipline. So they're not just midwifery, like other conditions, you know. And in gynae, with cervical cancer, it is seen as, oh, you've been around now. Now you've got cervical cancer. It's not actually that. So it's also that uneducated. So people look at conditions. Even HIV, that's the most common one. So people look at it like, oh, you've done this. You are categorized in that. When that's not actually what it is. So it's how people perceive things, especially being uneducated. So it's our job as healthcare providers to explain it to them. And there is a gap where we don't get the time or chance to do that.
And doctors are perceived as not having time because they are more busy. So it's left upon you as nursing who's looking at this patient for 12 hours a day to maybe wherever you can educate these patients about these social ills or what we perceive as outliers in our communities. Because like you said, we keep judging them. Doctors too. Doctors do judge patients, not just nurses.
I'm sure.
we just don't know where they're coming from. And that point is very poignant that you mentioned we need to incorporate social workers and just the awareness, who we are, where we come from.
We do.
Because in South Africa, we could be coming, both South Africans, but you live a different life. You could be coming from Franschhoek and someone's coming from Umlazi. You separate worlds.
Complete difference,
Yeah, and people don't understand that. That's where the nurses might bridge the gap. One of the most important things I've learned over a period of time is, as a nurse, because you run community clinics, you run immunization clinics, you run feeding schemes as nurses without the doctors. We've learned from countries like Cuba where preventative medicine is extremely important. Is there anything you would like to, I'm shifting gears now, as a nurse, where community health, where you find all these things that I've just mentioned, immunization, antenatal clinics that you run, that you just want to talk about, just briefly? Community service.
Yeah, for me, community service was more when I did ComServe at RK-Cons. But where I saw a big difference was when I worked at Dis-Chem clinic. So I had my own clinic in Dis-Chem, and we did primary health care. So it's like community service, because we're serving the community on all their basic needs, basically. So what exactly do you want to know about that?
Oh, no, anything that you'd like to share with us, your experience there as a nurse in a community service at Dis-Chem.
Well, I enjoyed it on my perspective, and it was much needed for the patients. So primary healthcare, in fact, we can rule out a lot of conditions with primary healthcare. So we were like the hub where you stop. And you won't even have to go see a doctor if you just come to us.
Yeah.
And yet people, they just go straight to the doctor. They're making more work for doctors where it's unnecessary. So
they spend hours away because you go to a doctor's room, it's going to see at 9, you end up seeing at 10:30. You pay more for going there.
Yeah, exactly.
And the same doctor sends you back to that pharmacy with the script. So, and I always tell patients, you've got flu, you don't have to go to your doctor. You need to rehydrate, you can take antipyretic cells and all that. But most of the time, a lot of those conditions are dealt with very well by the nurses. And people forget that.
Exactly. They don't know, I think. So there should be some
but
sort of...
I think they don't know, but they also don't trust.
Yeah.
How do you build their trust?
That's what
Because I'm talking as a doctor, I'm telling anyone who's listening, most of the time, and you mentioned that point, it came from you, you pick up a lot of conditions.
Yeah, a lot.
And you prevent progression of these conditions. That could become malignant in the future. I'm not talking malignant in the sense of cancer, but just becoming worse. You treat your blood pressure, you treat your sugar, you diagnose HIV, someone can be started early. All those things, nurses do and can manage.
Yeah, and we do that, but they don't know that there is such a thing as a primary healthcare clinic. Many people don't know. So when they do come to Dis-Chem, when I was at Dis-Chem, they were like, oh, I didn't know you'll have family planning like for so cheap, you know? Or there's pap smears. I thought you have to go to a gynae to do your pap smear. We have pap smears.
Very important.
So yeah, for Women's Month, pap smears are 250 Rand, you know? And they're like, oh my word. And we do the full HPV screening and all that. They don't know these things. So Dis-Chem would advertise, of course, but not many people look at the advertisements that are out. So social media is the biggest thing. TikTok and Instagram, Facebook. That is now the most common outreach that I'm seeing now with the younger generation. Because teaching medical students, you just see them, they're like, oh, did you see the TikTok this and that? And that's how they find out everything. The news is on TikTok even.
And it's instant. Yeah.
Instant.
And we're getting from the NAS today, we're hosting Whitney Houston, we're getting from the horse's mouth. I cannot overemphasize the importance of a NAS in any public world. Now, I like the story of Cuba because it's one of the best stories in the world. I don't know if you've got any experience with Cuban medicine, but they've shown the world, and for many years they've done so, where you prevent things like cancers. You pick up HPV. I'd like to come back to that. You pick up blood pressure very early on, so you're preventing strokes, preventing diabetes, preventing amputations, and all those things, feeding schemes, antenatal clinics, complications that could have happened. So I like preventative medicine. I'm not involved in it because of what I've chosen, but it's still the core. I'd like you to go back now to talk briefly, because you mentioned HPV, human papillomavirus screening. What is it? Is it important?
So it's a very common, so many people, women, in fact, before the HPV vaccine was now out, Gardasil, there's a Gardasil 13 and a 14, I think now, and a 19.
I know nothing, so you have to educate me.
Oh, okay. So before Gardasil came out, so like my age group, Gardasil.
It's called Gardasil.
Gardasil, yeah. That's
that
the
the
HPV.
vaccination?
Yes. So, yeah, we do vaccine training also. So that's also preventative. So before all that came out, now women our day, like when I was born, there was no vaccine for that, you know. So you are at risk for HPV, you know.
What does HPV, what may it do to your life as a young woman in the future if you contracted HPV?
Well, you're at risk for cervical cancer, firstly.
Is cervical cancer something serious?
It's the number one leading cause of death in women, apparently. Yeah, I don't know.
believe that.
Latest, that is what it is now. So what we've learned.
Is it an STI, form of an STI?
It is, but so you can develop HPV from a previous sexual partner where you were healthy, but you got it and then it gets severe later. So that's also the other thing. So you can't class it like it's just a STD, you know?
I said that intentionally because we look at STIs as, first of all, we classify people, low socioeconomic, multiple partners, or for STI, you need to have a sexual transmitted infection, you need to have a discharge, you need to have pain during sex. Some of these sexually transmitted diseases like herpes, it could be there without you knowing.
Exactly.
HPV could be there without knowing, without...
Yeah, but it gets severe, like once your immune system drops.
Yes.
Then now it becomes you get all the symptoms that you mentioned now, and you have to treat it, and then the risk for cervical cancer is very high.
So what I'm trying to put to public out there, you don't have to have symptoms. You do need to do pap smears. You need to be screened. You don't have to wait for symptoms.
Yes, please tell everybody that.
You're like saying, you know what? The day I get a stroke, I'm going to go check my hypertension.
It's
and
too
they
late.
want to amputate my foot, I need to go check my sugar. No.
Yeah.
Check your sugar first. Go to the clinics that are run by the nurses. I'm not sure if it's still the same. So when I grew up, there was something called Guamashu Polyclinic, which was largely maybe like 90% run by the nurses. Doctors would come and visit. A very successful story. So whoever's there out, please contact us on our bio. We'd like to know what happened to Guamashu Polyclinic. It was a flagship of a very efficient way of reaching out to the community and treat the community. And guess who's running it? The nurses. And I just wish that could continue.
Yeah, primary healthcare is very important. I can't stress it more, but people don't know about it, honestly. In fact, everybody that gets to primary healthcare eventually being referred, they're like, I didn't know you have this.
So you could prevent a lot of communicable and non-communicable diseases.
Yeah, and saving time and money and everything.
Money.
Yeah.
Right. Because now when you have this cancer, you need an MRI, you need a PET scan, you need a surgeon who have a skill to do this. And most of these things if we're taken care of at the nursing level, at the community level, it could have been prevented.
Yeah.
All right.
Yeah.
I have a daughter, so obviously I want to keep coming back to this HPV. So who should be screened for HPV?
So girls 9 and up start taking the vaccine. And they're giving it now in schools in the States. I don't know about private schools, but in the States they started giving it about 2-3 years ago now. So it's one of the standards.
So before menarche, before they start their
Before
periods?
they start, not that, before they start sexual intercourse. So that's
Okay.
why 9 is a good age just to rule it out. So they just say from 9 onwards. So we used to see a lot of like 12-year-olds and 13-year-olds all coming to Dishkim for the HPV vaccine.
Okay.
Very common.
Yeah. So yeah, it's something that I didn't know about until a couple of years ago. And at the time, I don't know if it was public sector or there was an age limit, but I remember you telling me there's no upper age limit now. Anyone can be screened.
So yeah,
And if you don't have it, you
so
can be
it's from
vaccinated.
12. The latest is 34. So you can't take the vaccine after 34.
Okay.
Not allowed.
All right.
Yeah.
Oh, that's good. And like you said, it prevents what kind of cancer?
HPV, all the different types though, and cervical cancer. So HPV has different it's like strains sort of. So there's 13, there's 11, there's common ones. So it screens you. If you see a Gardasil 13, it's vaccinating you against all 13 viruses.
Yes.
And then the 19, I think it's a 19, that'll be all the 19. So that one is expensive though. It's about 580 Rand for that one. And then the one they're giving in the schools are about 350.
Yeah. Well, it's expensive in our context, but if you think
Yeah.
about it, what you're potentially preventing, that's nothing.
Yeah.
If you think it that way, that, if you've got cervical cancer, not only that your life is abbreviated, but you could live for another 5-6 years with a lot of financial burden because, you need to be in the hospital, you need to be seen by doctors, you need to do all this expensive investigation.
Yes.
So I love preventative medicine. And once again, going back to the nursing, where your role is important. Let's shift gears a little bit. Every doctor has been an intern or housemanship if you're from North America. And in one of I love my internship. I did it at Natal Spirit Hospital in Israel.
Nice.
I'm always been a selfish person, so I look out for myself. So the first thing I decided to do, I'm going to be nice to the nurses because the nurses, they make your life easy or worse.
Did that work well for you?
Absolutely work well for me, and I'll tell you a story. But just what is your perception of the young doctors getting into mainstream medicine and the perception and relationship they have with the nurses?
Yeah, well, they are not very mature, naturally, the young doctors. They just came out of university. So for us, that's like you came out of school because most of them are very sheltered, most.
Yeah.
So straight from school, university, you haven't actually seen the world. So they're coming there not knowing.
And they think they know it all.
Yes.
I can say
They've
this.
got the big head thing now
they're
because
the doctors.
MBCHP, surgery, and they like, like I'm telling you and you must listen and I don't want to hear it.
And this person can't even put up an IV line.
Yes. Oh, we've seen that as well. In government mainly.
Yeah.
But yeah, it's you can't really say anything to them because personally we as nurses, we can only have a good relationship with doctors. Else it would never work. You can't be fighting with a doctor.
Yeah.
So unless you're an older nurse, they don't take nonsense. So,
what advice would you give these young doctors? I've got advice for them for days.
Yeah,
but
me
what
too.
What will you say to them to make their life comfortable? And obviously learning, because it's still part of learning being an intern, or even if you're a junior medical officer, you're still learning, right?
yes.
You might be a medical officer, your first or second year medical officer, but you might be working with a nurse who's been here for 15, 20 years.
Exactly.
Right?
And it's
She may
her
not
ward.
cut, but she knows what needs to be done.
Yes. Yeah.
What's an advice
So very
to these
simple form.
big-headed young doctors?
Yeah.
I'll call them that. Doesn't matter.
Doesn't matter.
To me, I'm old.
Yeah. I totally get you. I would say you need to start at the bottom best advice to them, I tell them in medical school as well. So when you start going to the hospital, befriend the nurses. You'll only start learning with them. And remember, it's her ward. It's not your ward.
Yes.
You can't walk in like you're the big boss. She'd be like, you didn't even greet.
Didn't
Who
even introduce
are you?
yourself. You don't even have a
Yes.
name tag.
Exactly. Exactly.
You're not
And
dressed
they-
appropriately.
And then they're like, oh, I can't find that and I can't find
I was
that.
about
And
to
we're
come
like,
to that, yes.
We're like, hence you can't find it. You'd have it. I don't even know who you are.
I'll be like, hey, Togo, kunjani, you know, yeah, because they can ignore you.
Yeah.
Now, you don't know where the tuning fork is at. You don't know where the thermoscope is at.
Exactly. Yeah,
you know,
nothing. The
yeah.
meds, nothing.
Yeah. They just need to be human beings
Yes, yes.
and stop this thing of being headed young doctors who know it all, because they don't.
Especially when you're starting.
Yeah.
Maybe later you can be.
That's okay, but when you are young,
Yeah,
you are inexperienced, and this ward is run by the nurse.
exactly.
Be respectful, and you get a lot of things done for you, besides being taught the right things.
So we tell them be a people's person because you won't go far if you're not.
Yeah,
Yeah.
yeah. So I'll tell you what I used to do,
Yeah.
right? As legally as I was earning at the time, I'll be buying them dinners almost every other week. I was bribing them. It was good for me,
Yeah.
you know, because they will teach me nicely.
Yeah.
They will charge my patient the way I like. I'll give you an example. So there was this guy, his name is Skumbuzo, doesn't matter now. Skumbuzo was big-headed, and Skumbuzo used to go and sneak out and do locums during the government time.
Yeah.
Doctors steal from the government, so let's get it right. Doctors, some of them, yeah. But Skumbuzo, not only that he was stealing from the government, but he was leaving his patients unattended to and shot at the nurses. So I think they decided to fix him at some point. So nurses, like I said, they've been doing this for years, right? They will know you come at 2 o'clock in the morning, they can
Yeah.
tell, okay, this is urgent, this is not urgent. So what they will do for Skumbuzo's patient that felt elective, they will just, he's on call, right?
Yeah.
So they will just, patients would come like 8, nurses make sure the patient is comfortable, give Panado, stack the patient, call him for those that are emergent.
Yeah.
Come 2 o'clock, he probably wants to sleep. This is a true story.
Yeah.
Then they start calling him at 2. He comes, they call for one patient. Because it's a big casualty service. At the corner there is gynae, internal medicine, surgery, peds. When you walk in, you don't know whether those are your patients.
Exactly,
They'll just
yeah.
push his patient at the corner there. Call him for one patient, comes, sees the patient, then goes back to his room, and then like, he's probably falling asleep now. Call him for another patient. Comes back, one patient, call him for another patient. Call
That's
him.
terrible.
That's good. It was opening his skull, thick skull. So they will call him throughout the night. And for me, I'll be called once. And what they will do, they'll do everything.
Yeah.
And then maybe call me in
Yeah.
the morning and say, DrVezi, we've done everything. We put up the IV line for you, this and that. You
Yeah.
can just come and sign as a doctor.
Yeah.
You know. So my life was easy.
Was easier, yeah,
I
because-
was nice.
Yeah.
And I was learning. So out
You
there,
need
young
to
doctors,
tell-
the nurses will fix you if you're big-headed. If you're nice, they will teach you. They will call you for something that is absolutely necessary, because the nurses, they've been doing this way before you and for the longest time, and they are good at it. So they will help you if you help yourself by being a nice person.
I'm glad
And
you
stop
told
being a
them
dick.
that. Yeah.
All right?
For once.
For once, yes. All right.
That's a good advice for them.
No, it is,
Yeah.
absolutely. You're now an educator. How has that impacted you? Because now you are a mother, you've got 2 cuties at home.
Yeah.
The transition, if I may call it a transition, because you still
Yeah.
do nursing a little bit, right?
Yeah, I was locuming in ICU for the money.
Don't you all?
Yeah,
Yes,
yeah,
yeah.
no, the money was better there. But no, the hours, it's 7 to 7. So the 12-hour shifts and night shifts, they were calling me for night shifts. It doesn't go well when you have kids. And my hubby's a doctor as well, so he does calls. It doesn't work for us. If he's on call and I'm doing a 12-hour shift, who's going to take and with the kids? You know, it just doesn't work. So, yeah, shifts was just not working for me. So I am not locuming now. But the transition has been more of an enjoyable one, I would say. I'm loving the hours. You would go in, you teach for 2 to 3 hours, 4 at most, and you're out.
Yeah.
You know,
Yeah.
you're marking papers, submitting. It's all like sort of in your own time.
Don't you have
So-
like a bit more paperwork to deal with? Which
There
I
is a little bit
absolutely
more, yeah. There's a
hate.
lot of admin actually. But you get used to it. In that first month, maybe it'll seem like a lot. But once you know the paper, like you know what you're marking, you know the papers, you know the forms you have to submit, the evaluation, you know how it is. So now it's like a quick, you know what you're doing.
Do you feel that the transition is working for you? I'll tell you about me. So I'm the electrophysiologist.
Definitely.
So, and I've always known that I needed time for my
Yes,
daughter.
yeah.
And it worked well for me. So people out there who are nurses, who are thinking about maybe going to education, is it a right? I don't personally like it because you're living my community. My community is still nursing,
Yeah.
but you have to be selfish. I'm a very selfish person. You have to do it for yourself.
Yeah.
What's the biggest gain besides just time?
Well, the workload,
It's workload.
is very chilled.
Yeah.
You know, if you know your stuff, prepare beforehand, and you're teaching what you're teaching, structured, you know, you can see that you know what you're saying, and that the moment your students do well, for me, that's all I need.
I think one of the most important things is that if you're an educator, you need to be pushing an envelope. You need to be at the front line of the current medical skill, the current data. So you've got to read.
Yes, there's lots of reading CPDs,
Yes.
so you do have access to that via your email. So we join the meetings, we feel fit, and then there's also like questionnaire things. So CPD points comes in like very quickly.
But
easily.
besides the conventional part of CPD, as a person, you tend to learn more
Yes.
because you have to educate.
Yeah, there's always new guidelines, new changes every time, continuously. So we do have a platform that keeps us informed. So it's very convenient. And that the moment you are educated in that, I feel like you know how the world works.
Yeah, so
also.
that's great for you.
Yes,
Right.
perfect.
That time, do you think is well spent with your family, yourself? Very important. We always forget about it. We always talk about family, which is absolutely important.
Yes.
But we forget about us as a human being, yourself. you know?
Yeah, so-
Like for instance, when I go to the gym, I've got a makeshift
Yeah.
gym at home. I don't answer my phone because that's my time.
Yeah.
That's my mental time,
Yes,
right?
yes.
So, do you feel you have that now more than when you're working as a nurse?
Definitely. I never used to actually work out. Only recently, now that I'm in education now, I've got time to do the workout. I'm not working shifts. So like
And with the kids as well.
yes, and
because
I've actually
your
become
hobby is
more
a doctor,
selfish.
so, yeah.
Yes. So I also was very selfless, and now I've become a little bit more selfish with my time, which you need to do as a mom and someone that works, you know. Else there's no boundaries, and you'll just give your all into what you're doing at work, and you lose yourself in that. And that's where you degrade, I feel. So only recently I started that journey, and it's going well so far. I can't wait to see where I'm going to end up.
is it?
Yeah.
Yeah. Do you feel probably you less irritable at home? You more approachable by your kids.
I
You
love that
know
question.
better what they're doing at school.
Yes.
You are a better partner. I don't know.
Yes,
Yeah.
it's like you know it all.
Yeah.
It's exactly that. Everything you said. Like I never had time for my kids when I was working. I would come home tired, and then lunches, and then and then weekends I'd be working most weekends. So now I'm not working weekends. It's like,
That's wonderful.
yeah, so my kids, I can teach my son swimming now, for example, when I couldn't do that before. So it's a big change. I would advise nurses, if you are very unhappy, which many nurses are, you need to change the narrative. There are many other things. My very good friend is doing occupational health, so she's also tired of the hospital. She's studying this year, occupational health. She's going into that. And then there you don't work weekends as well.
Yeah.
And-
So there are other avenues. I think
Yes,
once
yeah.
you find yourself in a corner and you're just going through emotions, you don't like it anymore, you just feel that there's a cul-de-sac, there is no way out. Actually, there are pathways and possible permutations. One that you said can go to education, occupational health. I want to touch on something that I really hate, but if I'm selfish, I expect other people to be selfish. With a nursing degree, you're marketable in the world. Right now, you can up and go to India, you can go to New Zealand,
Yeah.
you can go to Canada, particularly for Commonwealth. I know nothing was ever Commonwealth, but that's what's nice about being a nurse, because
Yes,
nurses
it
in
is.
South Africa, fortunately, and doctors are still well trained, well sought after.
Yeah.
So,
So the degree,
we'd like to
yeah.
talk about
Yeah,
that.
so you did stress it's the degree.
By the way,
yeah.
family, Rhythm Unplugged, I hate it because, of course, we're losing nurses to other countries. But you know what? It's important to know, like Whitney was saying, there are other ways, because you mustn't feel stifled and that you don't have options. You've gone to school, you've served your community. If you think it's time to change, Whitney. Houston, you're on the platform. Tell us about those possibilities of working elsewhere. So we've
yes.
spoken about education.
Yeah, yeah. So
You can go to industry.
there's a lot, yeah, there are a lot. So primary healthcare is one of them. Nurses, please take notes. Okay, if you have a degree, do this. If you don't, do the degree. There is like a bridging course sort of a thing where you can get a degree now, but it's not going to be there for long. They're taking it away. So your opportunity is now. So yeah, I would advise do that. There are many other things. I can't think of it offhand now.
But even like going overseas.
Yes.
And-
So
and SA
working on the
nurses have
ship,
been-
So working on the ship is one. Nurses that have gone on the ship are traveling for free and getting paid in pounds, dollars.
Nursing, we're in the ship.
On the ship, yeah.
Educate me.
So you basically like a primary healthcare nurse on the ship, or you like a casualty nurse, but on the ship. So you get paid like sky high. And
Besides the money, which is important, what do they do? They kind of like,
So
I
you're
guess people
doing-
in the ship, they get drunk.
Yeah,
The
there's
sugars
fights.
go up. There's
Yes.
fights. there's
hypertensive,
clubs.
diabetes, fights. So it's like how you see casualty things.
So it's more like an emergency room kind of
Yes,
service.
Yeah. But they are very
Ah.
quiet. From the nurses I know that I've taught at the Marines, where I'm teaching.
Wait.
They-
You teach at the Marines?
I teach Marine at
Is it?
Durban F13 campus, yeah.
All right, hold that thought. We'll come back to it.
Yeah.
So tell us about the nursing at the ship. It's casualty like, and they travel for free.
It's quiet, yeah. So you're traveling for free, okay? You get to get off when the ship docks. You get off. You see things, and
Different
you're
countries.
getting paid in pounds, and you come home for like 2 to 3 months
So
at
it's
a
quite-
time.
yeah.
You can buy a house, your car. Like you have to think smart. You have to go out there and see what's available. And
Yes.
nurses generally don't do that.
Yeah. I would think also if you like very young or very young family, I feel like maybe if your kid is still like under 5, that's probably the best opportunity, or when the kid is
Yes,
over
or
20.
older, yeah.
So formative years might be a bit dicey, but I think if you don't want to be in this red race where you're still paying your bond 15 years later and you're like 29, 30, I think it's a great opportunity.
Yeah, like get it
You
over
see the
and done
world,
with.
and
Get
come
your
back.
things, come back. Yeah.
Because I've done it myself. So when your kid is maybe well under 10, I think it's the best time to travel.
It is.
Yeah,
Because they're young.
Yeah,
still.
they're young. I think the issue with the absent parent, particularly the mother, and most nurses are mothers, there are fathers there who are nurses, big up to them, is that it's the formative years that are important. Teenagers need to be there. But
Yeah.
it's great that they can travel, see the world,
That's the
get
thing,
paid,
yeah.
and do what they love.
Exactly, yeah. So I would advise that as well. So don't go when it's too early also. Because especially if you're breastfeeding and all of that.
Yeah.
So not too early, but when they're young and can't remember,
Yes.
then go.
Can't remember, that's the most important thing.
So like below 5, like Brian said. But once that adolescence, teenagers, and they're
Gotta be
starting their
there.
periods
Gotta be
and the
there.
moods, you have to be there. So not that time. But like I said, study, there's other avenues. There's so many. Google them. There's a lot. I just can't think of all of them right now.
No, but you've said a lot.
Yeah.
Now let's go back to that thought. I said, hold on to Marines. You teach.
Yes.
What
so,
is it that you don't do? You're a nurse, you're an educator, you're at medical school. Marines?
Yeah, so I'm an educator at the Durban STC is where we teach all the Marines that need to do the medical course before working on the ship, they come to Durban STC.
What is Durban STC?
So it is, yeah, that's a good question. I
But you
don't-
prepare them to be on board.
Yeah, so yeah, STC started at Cape Town, okay? But we teach, what we teach there is diving. So you have to dive before you work on the ship.
Okay.
You have to do the fire training. I'm doing the medical training. So I teach elementary, medical care. There's a whole lot of subjects that we offer there. So if you're just going as a nail tech, like I've taught from a nail tech to the captain of the ship, the variety. There'll be a nail tech coming to do elementary medical care. They have to know the basics if you're working on the ship. So it's more like bio. What I teach is bio for that subject. Then we get medical care. So the captains of the ship and the nurses and doctors have to have medical care before going on.
At least basic life support kind of stuff.
Yeah, so it's like a conditions, what do you see, infectious diseases, the lot that we cover. And all the medical procedures, so emergency procedures that I teach at medical school, teaching same at FTC. So I am an educator, but teaching the Marines and students are two different things.
Okay.
Yeah.
All right. So you are a well-rounded, well-experienced young nurse who's got it all. Yeah, so thank you for being with us today. Is there any particular thing that you'd like to touch on? We spoke about a lot of stuff. We spoke about motherhood. We spoke about education. We
Yeah.
spoke about don't being stifled. There are many avenues out there.
Well,
Perception of the nurses.
Yes,
and-
yes,
yeah.
yes. Yeah, the perception. There is a lot. That, I had a lot of questions for you.
Oh, yeah. Okay, hold on to this question.
Yeah.
Because there's something I don't want to forget.
Yeah.
Coming back to the doctors and nurses. So I was one of those
Yeah.
doctors who would complain during my ward round, and then they say we used to start on time at 8. And by 9, and then we with a different nurse, and then 10 o'clock a different nurse. But one thing that I forgot is that most of those nurses that I worked with, I was either driving from, first of all, driving. Most of these nurses didn't have cars. I was coming from
Yeah.
DQ, which is a stone throw away, or I was like 20 kilometers away. A nurse who comes from the township probably has to wake up at 3 or 4 in the morning. You know, we don't factor that into that. You know, and they have to leave early because they have to go for public transportation. So there's a lot of things untold about the nurses, what they have to go through just to get to the hospital. You just jump into your car.
Yes.
They have to
yes,
go
yes.
for taxis
That's
or
true.
lift club.
Yeah.
If they're not there on time, they'll be left behind. So
Yeah.
I think doctors need to understand these things, and families and patients need to understand.
Yeah.
I know you're there for a care and you deserve your care, but if you can have a bit of empathy, knowing where the nurses are coming from, and the vast majority of these nurses
Yeah.
don't have the opportunities that, particularly in private, you know.
Yeah,
Like I said,
it's two different sectors, eh?
yeah.
Yeah.
I jump into my car. The nurse has to wait for the taxi to be full.
Yeah.
So I wake up at 6. She wakes up at 4. Right. So those are things that, as a doctor, particularly as a young doctor, you need to understand who you're working with, where they come. Like we were talking about social health. You know, you need to know where your patients are from. We need to know, as doctors, we need to know our colleagues, our nurses, where they're coming from. To me, that's extremely important.
It is.
Is there anything you'd like to add on that background
Well,
before you even get to work? Things that you have to go through.
Yeah, so yeah, it's like, especially with like moms as well, their job is not over. You think they're going home and they're relaxing. They're not. And then we have to be up early for the shift again, you know. And a lot of people, not just doctors, other people, like even physios, you know, they just see nurses in a category where you must just always be caring for the patient.
Yeah.
It's impossible. We're human.
Yeah.
So people need to understand nurses are also human.
Yeah.
We're not just working the few hours.
Not a machine.
It's a shift. So I think we're the only ones that actually do like 12-hour shifts in the hospital. The social workers and the psychs and all those people don't really do the shifts.
And talking about different shifts, you know,
Yeah.
in Canada, for instance, I don't know if
Yeah.
things have changed. Nurses were not allowed to work beyond 4 days a week. Now, that certain societies like Canada don't really have private healthcare.
Yeah.
So the nurses are protected. So here you could be working 5 days, 7 days. That's inhumane.
In fact,
It's
Intabeni is still doing 7 days on, 7
Now
days
that's
off.
those things
Up
need to
till
change.
now, yeah, it's ridiculous.
Yeah, and you blame the nurse on the 6th day they've been fatigued.
Yeah. On the same case, obviously she should be doing her job. You know, the moment she's not doing her job, I totally understand.
Yeah.
Okay.
But also we need to understand, and I like flipping the script. Some nurses, particularly those in government, they come and sleep during the day because they've been moonlighting. Okay, let's not run away from
That's
the thing.
another
That
thing,
is that is
yeah.
another conundrum. There, moonlighting in private hospital
Yeah.
at night,
Yeah.
and then the following day you go and work. You
In
know,
government.
you're making a bad situation really worse.
Exactly. So that is self-inflicted.
Yes, self-inflicted. I like that.
Yeah, that's now your fault. You can't cope like that.
Yeah.
In fact, they get into trouble, and it's like good.
This is criminal.
Yeah,
It's
because
criminal.
the patient's at risk.
Yes.
You know.
You're coming
And-
at 7, you're already tired because you're working the whole night moonlighting.
Yeah. And that's
We
the
understand-
opposite
yeah.
of our job,
Yeah.
giving the patient a risk
Yeah.
now because you're tired.
Yeah, and some of those things make nurses look bad, you know.
yeah.
And do doctors moonlight? Of course. But your expectation as a nurse is worse than a doctor.
Yeah.
Okay, you said you've got some questions for me. Fire, anything you'd like to talk
So,
to me
well,
about?
do
ask
you
me.
enjoy working with nurses personally?
I think if you're listening to me, you realize I really have a high affinity for the nurses.
Yeah.
One, because I understand that outside family practitioners like GPs, where they can work without a nurse, there is absolutely no other place I can think of where a doctor can exist without a nurse. A nurse can exist without a doctor.
Yeah.
We spoke about commercial polyclinic.
Yes, yes.
First of all, I don't have a choice but to work with the nurse. Secondly,
Yeah, so
I love
that's
working
why.
with the nurses.
Yeah.
No, yeah.
You
part of
said
it-
I don't have a choice. Well, if you had a choice,
I will always. How can I operate without a nurse?
Yeah, yeah.
How can I prep my patients without a nurse? Who feeds my patient? And I say, look, I'm running late. Feed my patients. And the patient, by the time they come here, 4 hours later than expected, they are less irritable. Nurses, for me, core, important, invaluable, indispensable.
Yes, yes.
So I love working with the nurses because
Yeah.
they make my life simpler.
so I'm
A lot more
guessing you
simpler.
haven't had a bad experience with the nurse.
Oh no, 31 years I'm a doctor. Definitely I've had bad experiences with nurses, but overwhelmingly great.
Yeah. Okay.
I shout sometimes. I do things I shouldn't be doing. I say things I shouldn't be saying because at the time I'm not thinking straight because things didn't get done the way I want. Of course, many times, but I would never be able to work and do what I do without a nurse.
Yeah, yeah. I'm glad to hear that because many doctors don't actually like nurses at all.
Can they work
They-
without a nurse?
and they say, like, we don't like the nurses.
Yeah, then go and work where there's only doctors and see if they can do all these things that you've been telling us
Yeah.
about. Can they? I mean, can you think of any other place other than a GP where a doctor can work without a nurse?
No,
I
not
can't.
at all. Yeah, it won't
Yeah.
work.
Yeah,
Yeah.
yeah.
So I'm glad to hear that. It's the first time I'm hearing this.
Well, your hubby is a doctor. How does he feel about the
Well,
nurses?
my hubby is very different. He's very traditional.
Do tell.
Yeah, so he's very traditional. He's not from here. He's from Cuba. So personally, South African men are not like they're not very like dateable, like for me. So when I found my hubby, I was like, you can see he's different. You know, he's very kind and understanding. When I met him, like it was just I was drawn to him. So. Yeah, I'm not gonna brag about him now, but he was different. So
Of course, you can brag. This is an open
yeah.
station.
So yeah, no, for him it was different. But I rarely meet doctors that are like him, and he knows that
You
himself.
haven't met me, of course.
Only
ask your sister.
recently.
Yeah.
Recently, yeah. So I didn't know there were doctors like you out there. They are high up in the sector, you know. Usually the ones that are like high up, like yourself, they are not nice people.
So we need to get the word out there. Doctors high up there, please note that you cannot work without a doctor.
Yeah.
If you can give me one scenario where you can work and perform your surgery without a nurse at all, please educate me, please. Yeah. So you guys are pivotal. And I'm
Yes,
not
yeah.
trying to suck up to you as a nurse, So I'm glad you found someone that was dateable. Those were your words. Kinder.
Yeah.
Yeah.
Yeah, much kinder. Yeah.
Yeah. How does he feel about the nurses? Not you as a person.
Well, now he doesn't like nurses, but before he really liked nurses. It's because of where he's working. I'm not going to give the name, but it's a lot of the nurses who are like what we were explaining. They're moonlighting, they're dodging, they don't show up, they don't
just
do
going
the
through
work.
emotions.
Yes,
You
they're
come
not
in the
doing
morning,
the work.
you work, you go home, you work, you go home, you do the bare minimum.
So his frustration is there, but they are the good nurses that
Yeah.
are actually running the hospital.
Yeah.
They're the only ones you can lean on.
Yeah.
But it's few.
Yeah. Actually, I mean, by the way, Rhythm Unplugged, I've met her hubby, wonderful person. I was drawn to him as well, not in the same way, of course, but yeah. So he's a kind guy, and I've never heard him say that, but I think he still like the nurses. He's probably
Yeah,
just
no,
complaining about those.
generally, yes.
It's just maybe he's not mentioning the vast majority. It's a 20-80, so he's just complaining about the 20%.
In government, it's different.
I know.
Dr.
I
Brian.
worked in government. I worked at King
Yeah, the
Edward.
nurses are not like in private at all.
They are not, but my experience is that the nurses in public are not particularly worse than private. I can tell you, there's certain wards.
Not worse.
Even
yeah.
this hospital, Busamed, where I am now, there is a ward where I wouldn't want my patients to go to. That's being honest. Now, whether it's because they are overworked or they are not interested, I don't know.
There's many reasons.
There are many reasons,
Yeah.
and I can't judge. But
Yeah.
I've had issues.
Yeah.
But I don't think your hubby doesn't like nurses. I don't think it's a fair statement.
Well, he has to work with them, so he makes it the
Makes things
best.
work.
Yeah, basically, he works well with them. But yeah, the complaints in government are never ending.
Okay.
The sector is falling.
Yeah.
Yeah.
Yeah. Such as falling, but okay, let's not sugarcoat it. Even in private, and I've been in private for 15 years now. 15 years.
Long.
There are places, like I said, I wouldn't want my mom to go there because it's just appalling, even in private, which is sad. It's just a state of health that is sad. But having said that, vast majority of nurses are good people,
Yeah.
and we cannot work without them.
Not at
Now,
all.
you have a daughter. How old is she?
Yeah, she's 3. She'll be 4 next month, though.
Okay, this is a sexy statement. If she were to be a nurse, because you have a son, he could become a nurse. Okay, let me
Yeah.
walk me back. If any of them
Yeah.
wanted to be a nurse, what would you say to them? While you're thinking, if my daughter wanted to be a doctor, I'd be happy. I would wish that you would make that decision very early on.
Yeah.
Hi, Zimasa. How are you doing? Yeah. So, what do you say to any of your 2 kids if they wanted to become
Well,
a
if my
nurse?
kids wanted to do anything, I would never shy them away from it. But with nursing, be prepared to work. You are going to work. You won't make it if you can't work. You have to work your arse off. I'm going to say it plain as daylight. And also, well, the studying is not so bad as when becoming a doctor. I'd say it's doable. But you got to work, and you're going to work hours. Especially if you want to climb up, you have to work.
Yeah.
And
Hard.
lazy nurses don't do well, eh?
Yeah.
They drop out, they screw up and leave, they lose their practice numbers. So, yeah, you can't be doing the wrong thing.
Oh, yeah. I know Mawanda Creative Replay is tossing up and down. He's saying we've been talking way too much, but I'm enjoying this. You just touched on something briefly before we part ways today. Thank you for joining us, Rhythm Unplugged, with the creative Mawanda at the back, Creative Replay. You touched on the practice number. So can nurses practice independently?
Yes.
Do
In
tell.
fact, I know a few here in Umhlanga as well.
That's another avenue out there.
Yes, it is. So they have their own office. They're doing exactly what, for example, I was doing at the scheme, but privately, so the money comes to them, you know. So what they're doing
That's good to know.
Yeah. So own practice, you are doing, so they do midwifery, breastfeeding, so antenatal, postnatal care, family planning, pap smears, implant. So
Midwifery, they can deliver at home.
yes, basically. And then also, so the implant on, to put the implant on, family planning thing, you know, the one that
Yes,
goes in
yeah.
your arm, they do that. And the medical aid pays for treatment and the product to that nurse that had their own practice.
I like it.
So like, yeah. So it actually
Once again, it's another permutation, another pathway that a nurse can take if
Yeah.
you feel stifled by the public or the private sector. For instance, I implant pacemakers. We have generally about 2 to 3% sepsis. So we know that there are nurses who do what's called a wound care nurse. They attend to the wound. They are better than doctors. They treat wounds better.
There's
We
big
also-
money there in
we
wound
also put in
care,
like long-term dwelling lines, PIC
Yeah.
line, where nurses can administer intravenous antibiotics at home. Let me give you a scenario. So you have a septic pacemaker. 20 years ago, you have to be in hospital for 4 weeks. 4 weeks.
Yo.
All you're just doing is sitting there and waiting for the nurse to come and give you the same antibiotic, right? Now, with the home care, which is run by the nurses, another possibility that one might take. So they will do the IV antibiotics
Yeah.
at the comfort of your home. They come to your home. They will do the wound care. I mean, can you imagine? You can even still work. Sorry about that. Yeah.
Okay.
You can still work. You can go
Yeah.
to work in the afternoon. The nurse comes, checks your wound, delivers your antibiotics. So this is a fantastic opportunity for
It is,
nurses to be
yeah.
out there. And thanks for reminding me about the practice.
My chest, yo.
I think I talked too much.
Yeah, no. Something happened.
Yeah.
Might
So
just
in
be the
closing,
ego.
before
Yeah.
you choke to death,
No.
it's been wonderful.
good.
We've
Yeah.
taken a journey from how you became a nurse. You come from a background of mom being a paramedic, sister being a doctor, your hubby being a doctor. You shifted into education. You gave us
whole
pathways
family,
of other things you can do. Hopefully, we change the perception of the doctor-nurse relationship
Yeah.
and opportunities.
Yeah.
Don't cry now. You're doing great.
No, with the coughing, my eyes, I'm fine.
So thank you very much for being with us today.
Thank you, Dr.
Whitney
Brian
Houston.
Vezi. It was nice being interviewed for the first time.
First time.
Yeah.
Where are all these people? They should have done this many years ago. One of the first thing I told Mawanda was that I really would like to sit with a nurse because this is someone I work with intimately, and closely. This is what I knew there was something I forgot.
Yeah.
Historically, nurses end up with doctors romantically, right?
Yeah.
Where does that come from?
So
Your perception, is that true?
it's a good question. Well, I'm realizing with the older generation, definitely.
Well,
But
you know,
now-
older generation, your hubby is a doctor.
Yeah, but it was more
You're the
common.
prime example.
Yes. Yeah, okay. But remember, I'm in my 30s now. So, like the younger generation after
But
me.
you've been with him for almost 11 years.
11
I'm revealing
years.
out there.
Yeah,
Yeah.
11 years.
Well done. A decade down the line.
Oh, thank you.
2 beautiful babies.
Yes. They are adorable. So with anyone, I think, like younger than me, like 5 years and younger, that's not really happening. Yeah. So now it's like it's seen as a class thing. So like the doctors usually like other doctors or like someone that's earning on that level. Now it's like, if you watch Materialist, the movie, you will totally understand it. And then the nurses are more like, in fact, they date guys that are earning either their amount or sometimes less, generally. And that comes with the caring aspect, I think, you know. And now it's all like class. The dating world has changed completely. From when I started dating, it's completely changed. Like, I can't even recognize what's going on.
Well, during my time, it was very easy because medical schools were hospital where doctors trained. They were called University Hospital, for instance. If you're KZN, it will be King Edward. If you're in Johannesburg, it will be Baragwanath. If you're in Cape Town, it will be Hogeskill, right?
Yeah.
So Hogeskill, Baragwanath, King Edward, all these names have changed now. There'll be a nursing school, a medical school, all right? So a doctor in his third year,
Yeah.
probably 21, 22, first time he goes to the ward, who does he meet? Junior
Exactly.
nurse, who's well aged for him because she's just started nursing. She's like 19, he's like 23.
Yeah, yeah.
So it was a
It's
perfect, yeah,
perfect.
it was
Yeah,
perfect, right?
yeah.
But now the nursing schools have changed, right? So
They are away from the
they've
medical
taken away,
school.
which
Yeah.
is so sad, right?
I don't know why.
So who's training nurses now, other than if you want to go and do a degree? Where do nurses train?
They train in the private hospitals, all right, or government actually. So, like Eddington has a
Still
nursing
has?
school. Yes,
Oh,
yes,
great.
yes.
I thought they were all done and dusted in a sad way. by
And
the way.
RKCon has their students, for example. And private sector, so there's one at Interbeni. There's DUT nursing school. There's a lot of nursing schools. And they are not generally based at a hospital. Like DUT nursing schools, not at a hospital. So they get sent to the hospital to do their pracs. They are separate from medical schools.
And I guess when they go to private hospital, they're very young and doctors are much older because, unlike I
Yes.
said, if you're at King Edward
Yeah.
as a third-year medical student starting to
Then
go to
you're
the ward,
meeting
you're
them.
like 23 and she's like 18. So you say
Yeah.
that has changed.
It has, yeah,
Okay. I'm not sure
drastically.
how to feel about that, but yeah.
Yeah. I
Anyway,
wish it was like back in the day. Also, social media. So people are meeting partners on social media before they even go to the workplace.
Yeah, yeah. But thank you very much for being with us today, Whitney Houston. It was a pleasure to
Thank
educate us. As an educator, you've done this brilliantly. I couldn't
Thank
have
you.
imagined this any other way.
Yeah.
For further information, please click on our bio. I'm with Creative Replay here, Mawanda Mapumulo. Thank you so much, Mawanda, for hosting us. And thank you to you once again, Whitney Houston.
Thank you, Dr.
for being
Brian
part of this
Vezi.
family.
Thank you.
Thank you.
Thanks.